Hi everyone, I'm Donna Steele, the host of SPED Talks, and I'm so excited that you've decided to join me on this journey. I have been in the field of education for the last 15 years with a specialization in special education. I presently work as an educational consultant as well as an educational therapist slash special educator here in the States. I have a wealth of knowledge from having worked in Jamaica in the field as well as different parts in the US. I have worked from being a classroom teacher as well as all the way up to teaching students at the university level. Now, I am hoping that I will be able to provide you with pertinent, up-to-date information as it relates to special education. I do not know everything, so let me put that disclaimer out there. And if you feel like there is something that I did not cover in depth, feel free to shoot me a message, send me a message, an email, whatever the case may be, and we can have dialogue about it. I'm just taking it from the perspective as someone who has been in the field for 15 years. I am not a parent of a student with special needs, so my perspective and your perspective might vary, but I'm open to your opinion, your perspective. So feel free, if I've not covered something in its entirety, or you feel like I have not done that topic justice, by all means, reach out to me. I'm open. So without further ado, in today's SPED talks, I want to look at special education and what it is, as well as those eligibility areas where students, that will determine what if students qualify for special education, yes or no. So without further ado, that's what we will look at in today's presentation. And please note, I intend to go up to maybe 20 minutes tops. I never ever want my presentation to go above. So if in fact I do not get to cover all of my slides on my presentation, I will do a part 2 and if necessary a part 3. Let's get into the presentation. Thank you. We're going to start by looking at special education. What is it? And areas of eligibility. What constitutes a person being given that made eligible to receive special education services. So what is special education? When we think about special education, a lot of people, especially in the Jamaican context, they think about students who can't, they think about students who are handicapped. In other words, still children that are fool. So I'm going to put it very blunt. But special education really is a specially designed instruction that addresses the varying needs, those unique needs of a student eligible to receive special education services. So it is us tailoring the content to fit what the student needs. So as teachers, we're tailoring the content in terms of the learning that we want them to gain, tailoring that, tailoring the environment, tailoring whatever needs to be tailored so that that child can produce at their optimal level of functioning. It includes related services. And when I talk about related services, we're talking about whether access to speech services, whether access to occupational therapy, if their fine motor skills are not working so well. Note, special education is provided at no cost to parents in the US. In Jamaica, this may or may not be free. All right, the cycle of special education. In order to understand special education, it is like a revolving door. It has several processes that has to take place for the whole process to work. And my diagram here, it says the special education cycle. We usually start right here with a child find. And this is a screening or study committees that identify children for referral. Now, in a lot of cases, this could be in just that the teacher has identified that the student has some deficits, not functioning in the regular education setting, and as such may decide to provide a referral. So they have identified that the child isn't functioning, and then they might provide a referral. Sometimes the child find can be done just through government agencies going around and screening children to see if there's any issues. But this could be the parent who found out, it could be the teacher, it could be any stakeholder that works with students. The referral, this made by any source. Again, the child study from the child find could give you that information. It could be a committee, school staff, parents. From there, what is done next is an evaluation. In the States, this is supposed to be completed within 65 business days after receipt of said referral. Now in Jamaica, there is not a timeline per se. But yes, so after the referral, an evaluation is done in Jamaica. This can be done by a micro college, different places that provide educational evaluation. It also could be done by private entities. There are a number of those. In the US, this evaluation can be done by a school psychologist. Yes, a number of the schools here have school psychologists who provide these evaluation. From the evaluation, then there's an eligibility determination. So a meeting is held and where they go over the results of the evaluation, and then it is determined if a student meets or not meet eligibility requirement. If that is the case and the child is eligible, then you move on to the next step right here, where an individualized education program is developed for the child, usually by a special education teacher with recommendations from the team. If not, then the child, it goes back to his or her regular classroom without an individualized educational program being designed. However, the child may receive intervention if the evaluation results suggest that. From the individualized education program, the child receives services, and these services are specific to the needs of the child. So, for example, a child was found during the evaluation that they're reading behind 3 grade levels and they have a learning disability, let's say dyslexia, for example. The child would receive reading services to help the child, kind of mitigate that dyslexic label in terms of provide services that will help him or her function to his or her full potential. From there, an annual review will be done. An annual review is just a meeting with all the stakeholders in the special education process where they come together and they review how the child has been progressing throughout the year. So they go over the data to see if some of it is relevant, if the child has made improvement, if the child has not made improvement, and what needs to be done. So an IEP must be reviewed at least once per year for those checks and balances to be in place. All right. Now, special education, it just doesn't exist in a vacuum. There has to be policies in place, legal considerations, as I like to call it, that sets the framework for what such students need in terms of their rights and what they deserve. So these are the legal considerations that I've pulled out. In a Jamaican context, we use the UN Declaration of the Rights of the Child. Every child has the right to an education. This includes children with varying levels of disability or challenges. So we cannot make the decision that this child doesn't fit the profile of our class. So we're going to not provide for those children's needs. So this is where that comes in the Jamaican context. However, a more poignant definition, or for want of a better word, policy that governs the US system is the Individualized with Disabilities Education Act. This is actually a law that states that guarantees a free and appropriate public education for all eligible students with disabilities. So it's a little bit even more specific to students who are eligible with disabilities. So first and foremost, their education has to be free and appropriate. It has to be appropriate in the context in which they were labeled or they were eligible to receive these services. All right, special education in the Jamaican sense, this is what the Ministry of Education under the Special Education Unit has come up with. It develops and implements policies for the education of students with special needs. It supervises special education schools and units island-wide, most of the government schools, the ones that would have received grants from them. They supervise special educational facilities, whether it be private homes or community-based schools and groups. And they assist with the supervision of the curriculum and provides monitoring, assessment, training, and services. So the special education units within the Ministry of Education is tasked with these responsibilities. And if you should have questions concerning your own child, this is where you would go. Now, note, every region in Jamaica has a special education unit where they can deal with all your queries. All right, this is the part that I feel like sometimes we don't know, especially as educators, what we're dealing with. And I will now move on to defining the exceptionalities and what that looks like in the classroom and how to mitigate or put strategies in place to mitigate against the challenges that these students face. All right, so the areas of exceptionalities as defined by the Ministry of Education in the Jamaican context. They have it in 7 different categories, and I will show you what the US context, how the US context looks at it. Here we have hearing impairments, visual impairments, physical impairments, mental retardation, giftedness, learning disabilities, and autism. So these are the 7 areas of exceptionality that Jamaica recognizes. All right, the IDEA, on the other hand, which is the US version, looks at, it defines 13 eligibility categories of special education, starting with autism, blindness, deafness, emotional disturbance, hearing impairment, intellectual disability, multiple disabilities, orthopedic impairment, other health impairment, specific learning disability, speech language impairment, traumatic brain injury, and visual impairment. Now, I want to draw your attention that even though Jamaica has 7 eligibility categories, some of it takes into some of these that are here. So it has a generalized topic for the Jamaican sense. Here it's a little bit more specific and looked at individually. So it's not so much that we don't pay attention to these in Jamaica, what is not listed on theirs, it's that they have kind of looped it into one major category in some instances. All right, so we're going to move on to the overview of each category, which will include a definition, as found in IDEA, characteristics of the disability, and potential impact of that disability on curriculum and instruction. Note, if this program, SPED Talks with Donna, the aim is to go up to 20 minutes. So if we're going a little bit over, I might break this video and do a part 2. All right, the first one we're going to look at is autism. Autism Defined is a developmental disability that significantly affects verbal and nonverbal communication and social interaction. It is also called Autism Spectrum Disorder, or ASD. The disorders can range from mild to pretty severe. It is the fastest growing disability in the 21st century. The characteristics of our autism, it's a neurological disorder, meaning the brain is involved. Cognitive abilities range from gifted to cognitively delayed. So a student with autism, they can be gifted. It doesn't have anything to, it manifests itself differently in different students. Uneven profile or splinter skills. What this means, a student with autism, the profile, you cannot fit them into a box. There we will have somebody who's gifted here and has autism, but then when you check on another particular skill, it's very much delayed. So the skills are not consistent. Usually identified in the first 3 years of life. And as of right now, the ratio from male to female is 4:1. So mostly males, you will find mostly males with autism. The impact of autism in the classroom, students may persevere on a topic. It means they will repeat. There's a lot of repetition. They appear to not be paying attention. They may call out answers. They may be a little bit impulsive. Struggles to attend to tasks, have limited interest, have interfering behaviors. So even though this is just some generalized term, different students manifest it differently. So this, you might not see this with your particular autistic child. Student may also have difficulty sharing, taking turns, because remember we said that it affects the social interaction. I mentioned that in the definition. Have difficulty with noise or visual stimuli. So things might be sensitive to them. So yeah, not understand the big picture, struggle with transition or change to routine. They may fidget, rock, flap, or what we call stim, run from stressful situations, or not understand abstract concepts. So if it's not concrete or to the T in terms of what it represents, if it's just, when we talk about abstract, it's not concrete. You have to just kind of read between the lines. Most autistic students, they need it to be very straightforward and concrete and to the point. Students may also lack reciprocal communication skills. So you might be communicating with them and they are not receiving it, or they're not reciprocating what you're giving to them. Not understand nonverbal cues, jargon, or slang terms. Have difficulty with volume control, cadence, intonation, use echolalia, meaning they'll repeat what you've said to them, road phrases or scripts, use large vocabulary but not understand, or some may be nonverbal completely, where they're not even talking at all. Now we can move on to deafness and deaf-blindness. This is also another category. But deaf-blindness defines simultaneous hearing and visual impairments, the combination of which causes such severe communication and other development and educational needs that cannot be accommodated in the special education programs. So for children with deaf-blindness, they are affixed, they have two disabilities here. It's not just they are battling with the fact that they can't hear you and they can't see you. And the characteristics of deaf-blindness, a student who falls in this eligibility category has any communication of vision and hearing. Let me read that again. A student who falls into this eligibility category has any combination of vision and hearing loss, not necessarily complete deafness or complete blindness. So it could just be that they're hard of hearing, or they're not fully, they don't have 20/20 vision, or they're not fully blind. So it might be in one eye and the next eye is completely fine. They have wide range of cognitive and developmental abilities. So deaf-blindness doesn't suggest that because a student isn't able to see or hear you, it doesn't mean that their cognitive ability is limited. In some cases, where a child is challenged with multiple disabilities. But people tend to draw the conclusion that because you can't hear or you can't see them, your cognitive abilities are delayed. And that is not necessarily the case. Yes, in cases you might have that, but not all the time. The impact of deaf-blindness in the classroom, information must be introduced deliberately and systematically. Because remember now, they are not able to see or hear you. So you have to be very deliberate and systematic. You have to be very intentional. Many individuals utilize the service of support service provider. So this is where you have teachers who are able to do sign language, teachers who are able to use Braille. Other service providers are brought into the mix to help them to reach their full potential in the classrooms. Deafness defined, a hearing impairment that is so severe that the child is impaired in processing linguistic information through hearing with or without amplification. Characteristics of deafness. So now we're looking at deafness, not blindness. We're looking now, not deaf blindness. Now we're looking at deafness. Characteristics may also have difficulty with speech, reading, and writing skills. You can see how that could happen, right? Because they're not able to hear themselves, they're not able to hear sounds, so speech might also be a problem. May use speech, lip reading, hearing aids, and or amplification system. Jamaican/American Sign Language may be their first language and English may be their second. The impact of deafness in the classroom, seating being in the view of teachers. So you want to be very careful because especially in the American school system, a student who is deaf might not necessarily be in a special school that caters to deaf students. They might be in the regular classroom with support. So teachers want to be mindful that they're seating them in the close proximity to themselves, to teachers, or whoever is providing the instruction. Written supplements to oral instruction. Remember, they can't hear, so you have to have some written form of information. So whatever you're producing orally to the other students, you might want to have a written version for the deaf student. Visual aids or clues. So you want to provide them with visual aids or clues so that they can follow while in the classroom. Make sure you have the students' attention prior to speaking. So you want to let them know that you're about to speak and so that they can get ready and put their attention in your viewpoint so that they can follow along. May have difficulties with social, emotional, or interpersonal skills. And again, if you can't speak or you can't hear, naturally that is going to affect how you socially and emotionally interact. So those interpersonal skills might not be there, because your confidence is kind of shaken right now, especially in a classroom that is inclusive. Will usually exhibit some form of articulation difficulty, can become frustrated, and may have behavioral concerns. The use of hearing device does not return a child's hearing to normal. It basically amplifies it, but it does not return it to normal. It's a short-term fix. And lastly, deafness in the classroom, they may benefit from small group instruction as opposed to just large group instruction. So small group instruction or individual instruction if you can provide it. All right. Emotional disturbance. This is where, as you can see by the image, and I'll go in depth. It's a condition exhibiting one or more of the following over a long period and to a marked degree that adversely affects a child's educational performance. So it's an inability to learn that cannot be explained by intellectual, sensory, or health factors, and an inability to build or maintain satisfactory interpersonal relationship with peers or teachers, inappropriate types of behaviors or feelings under normal circumstances. So as the word suggests, emotional disturbance, a lot of it has to do with those social emotional aspects as opposed to merely intellectual, sensory, health factors. Those are not the factors that causes a child to have emotional disturbance. A general pervasive mood of unhappiness or depression, a tendency to develop physical symptoms or fear associated with personal or school problems. A lot of it has to do with the environment. Studies have shown that a lot of it has to do with the environment that the child spends most of his or her time. So when they come to school, it follows them and it manifests itself in what I described initially. Emotional disturbances may characterized by hyperactivity, aggression, or self-injurious behavior, withdrawal, immaturity, or learning difficulties. And you can see why learning difficulties might be a challenge, even though they're intellectually not affected. I mean, cognitively they are capable of it, but they might have learning difficulties just for the simple fact. Think of yourself when you're depressed or not 100% happy, or you have other things going on. It's the same thing. The impact of ED in the classroom, the inability to exhibit appropriate behavior under ordinary circumstances, inability to maintain relationships. It may affect inappropriate affects such as depression or anxiety, inappropriate manifestation of physical symptoms of fear in response to school or personal difficulties. And that brings us to the most common disability that we see among our students. Most of it is it's a hidden disability. You can't look at a child and tell if a child it has a specific learning disability. So if you look at this picture, this young man, you would not be able to tell if he's battling with what we call a hidden disability. So we're going to look at this in depth, and I'll probably wrap it up here because I think I've gone over the 15-20 minute mark, and we will pick it up back next week. All right, so a specific learning disability defined. It's a disorder in which one or more of the basic psychological processes involved in understanding or using language, spoken or written, that may manifest itself in the imperfect ability to listen, think, speak, read, write. And pretty much what this is, it's where your potential doesn't meet. It doesn't, what you're putting out is not your potential, is not reflecting your true potential. So the efforts that you're putting out in school, not reflecting your true potential, what you're actually capable of doing, because there's a disconnect. So when you have, this can be caused by a brain injury. It could be caused by what we call dyslexia, which is where you have some difficulty reading. It could be caused by what is called dysgraphia, which includes writing, having some difficulty with writing. It could be caused by what we call dyscalculia, which is difficulty doing mathematical problems. So it's where your potential is not meeting what you're capable of doing, given the effort that you've put out. So those children who have worked really hard and studied really hard and yet still the report cards are very bad, that would be an example of what a student with a specific learning disability, what it would look like for them. So they're putting out everything, but then when the parents go and pick up that report card, they're still seeing these failing grades. It's because there's this disconnect between the effort that they put out and the potential that they do have. All right, characteristics of specific learning disability. It may impact your reading, your writing, your oral language, your math, your study skills, because some people have to learn how to study. We take it for granted that, oh, you go to school, you need to read over your notes, you need to write over your notes, but it's not that easy for some people. Some people have problems with organizational skills, which can fall under study skills. Impact of SLD in the classroom: slow reading rate, frequent spelling errors, difficulty copying, difficulty memorizing basic facts, difficulty describing events, difficulty interpreting subtle messages. So with them, it can't be subtle, you have to be very direct. And these are just some of how it manifests itself within the classroom. Now, as promised, I want to end on time, so we will stop here for today, and next week I will continue with the other categories of eligibility for special education. Feel free to send me your messages, your questions, your concerns, and if you felt like I have not addressed a particular topic efficiently or effectively, please feel free to call me out and send me something giving me your perspective, because I'm open to that. I don't know everything, but I've been working in the field for a while, so I feel like I can speak on some of it. But again, I'm not a parent with a child with a special needs, so perspectives may differ, and as well as teachers may have different perspectives given their own experiences. So just feel free to hit me up. Yes. So there you have it, the first episode of Sped Talks with me, Donna Steele. Feel free to hit me up if you feel like I haven't touched on the areas that I touched on today. If I did not do it justice, I'm open to correction or different perspectives. So please don't be shy. Let me know what you want to see. I will continue next week with the different categories of eligibility of special education. So until next time, thank you.